Hi everybody, Margo Steinlage here with Steinlage Insurance Agency. This year during the annual enrollment period, October 15th through December 7th, I've been getting a lot of questions from clients regarding moving from a supplement to a Medicare Advantage plan. A lot of my supplement policy holders are getting bombarded with solicitations and commercials regarding Medicare Advantage plans. And they have a lot of questions because they hear free vision, free dental, free gym membership, free extra benefits. And they want to know what's up because they're not getting that free service with a supplement. So the first thing to understand is that when you hear free, typically this is a Medicare Advantage plan, which is quite a bit different than a Medicare Supplement, also known as Medigap plan. Medicare Advantage plans, you no longer have original Medicare as your primary payer. You are now enrolled in a third-party Medicare Advantage plan. These are your HMOs and your PPO plans. And that third party, also known as Part C Medicare Advantage plan, HMO or PPO, that third party is now dictating your care, running your care, or managing your care. So you are now in a networked plan, so you have to make sure that your doctors are in that plan's network, or you're exposed to a much higher percentage of the cost with a PPO plan, or sometimes 100% of the cost with HMO plans. Also, with these Medicare Advantage plans, you are typically required to get a referral for HMO plans, a referral to see your specialist. And with PPO, sometimes there's a little more flexibility. It's important to note that, yes, the Medicare Advantage plans are much lower premiums, but you have coinsurance and copays for more or less all services that are used throughout the year. So if you go in to see your primary, you go in to see your specialist, you go into the emergency room, urgent care, if you have a hospital stay, you're looking at a large copay. And those copays are being added up each time that you use care. So when your copays meet a certain max out of pocket, let's just throw out the figure $4,000. Once your copays meet a max out of pocket, then your Part C Medicare Advantage plan, either HMO or PPO, will come back and pay 100% of the costs of any remaining medical bills for the rest of the year. So, yes, these Medicare Advantage plans are free. They include basic dental, vision, hearing aid coverage. Some offer the gym memberships. But you have a network that you're responsible to stay within. You sometimes need to use referrals, prior authorizations, and you are exposed to coinsurance and copays for all services up to that max out of pocket. Again, so if you are moving from a supplement into a Medicare Advantage plan, yes, you are kind of limiting your access to care because you're in a network, but you're saving some money if you're healthy and you're not paying these copays. It's important to note that if you drop your supplement coverage and move into a Medicare Advantage plan, and then 3 or 4 years later, you call us up and you say, oops, I need to get back into this supplement. My doctors aren't in network. I need, access to Mayo Clinic or cancer treatment out of state. That's when you have the hurdle of answering health questions and going through medical underwriting to get back into your supplement carrier. The supplements across the board can either deny you based on your current health, they can withhold pre-existing coverage up to a certain time frame, or they can accept you outright, or they can accept you at a much higher premium because you are high risk to that company. So when you are leaving the supplement world and getting into a Medicare Advantage plan, there's a few just hurdles and headaches that you want to be aware of. There's pros and cons to both sides. If you want further information, feel free to reach out to us. Send us your doctor list and your drug list. We can walk through and see if your doctors and prescriptions are covered under any of the Medicare Advantage plans. Otherwise, you'll just stay put in your Medicare Supplement Plan. Any questions, call us. Thanks for being a valued customer. Have a great day.